So the symptoms with which these patients present differ according to what is the disease that we are looking into. For example, with retinitis pigmentosa, most people present with difficulties with night vision. A child has come from playing outside to inside the house and struggles a bit, or one of the commonest symptoms that people face is when they walk into a movie theater that's already dark, struggling to find a seat. So these are some of the early symptoms that retinitis pigmentosa presents with difficulty with night vision. Now, this can start anytime in the first or second decade of life, but as the disease progresses, the difficulty they have is with side vision. They may bump into people, they may bump into objects, they struggle to walk down a flight of stairs. That's because typically we are then looking at the lower field, which is now affected. So if you have a field of vision that is restricted, most of our lives is spent looking at our eye level and a little below. Because of that, what happens below the eye level becomes very, very important to a person. So they struggle to find the last step on the staircase, for example. Or, if a surface is uneven, uneven road and so on, they struggle to walk. So this difficulty with side vision is, what happens as the disease progresses. And in very advanced stages, of course, they would have tubular vision. And a small number of them lose all vision by their 40s or so. So that's retinitis pigmentosa. So there is a group of conditions called macular degeneration or Stargardt macular degeneration. This, in a way, is sort of works exactly the reverse way of retinitis pigmentosa. In Stargardt macular degeneration, the child starts struggling with central vision in the first decade or maybe by 15 years of age. So the child is not able to recognize letters on the board in the classroom, look at a slide at the distance and so on, whereas the rest of they don't need to have any difficulties with night vision or the side vision difficulties. Their main difficulties is with the central vision. That's with Stargardt macular degeneration. Now, the other one that I mentioned was Leber's congenital amaurosis, or it's called LCA. Now, LCA is the most severe form of all of these. Most children have symptoms by the time they are 2 or 3 years of age. It's recognized in infancy in many children. And this is one of the most severe forms of the disease, where a sizable number of them may lose all useful vision by the time they hit their second decade. So that's how the symptoms present across these three diseases mostly. There are similar diseases, like retinitis pigmentosa, but mostly these three are the ones that we, see commonly in India or the rest of the world. So with LCA, the parents do notice that the child is, not focusing on them and not able to recognize them. So LCA does get diagnosed, fairly early. And yes, the child is not saying much except that the parents would recognize and take the child to an eye specialist, and that's how the diagnosis is made with LCA. Now, with Stargardt, definitely because the child would say that he or she is not able to see the letters in the classroom. That's the commonest presentation with Stargardt degeneration. Some of the difficulties with conditions like Stargardt and LCA can also be that, in the very early stages, when an eye specialist looks at the retina or, does an eye examination, it's not very clear that the child actually has a problem. This is especially common with Stargardt macular degeneration, the early form. So there is, with Stargardt, there is a group that presents by 7, 8, 9 years of age, and there's a later onset. The later onset is quite clear because, you see changes in the retina and so on. Whereas those that present very early, by the 7, 8 years of age, it's not very uncommon for the parents to be told that the child's eye looks completely normal, but the child is complaining of a problem. And so maybe we got to look at somewhere else. I've had a few children actually being referred to a psychiatrist saying that maybe the child is not able to cope in the class and so on, and there is nothing really what we call as organic inside the eye. When you find something in the eye that you can say that this is what is causing this, is called an organic disease. So there are children referred to for a mental health evaluation saying that the child probably is not able to cope. So this is unfortunately difficult with Stargardt's or sometimes LCA. Whereas with retinitis pigmentosa is quite clear. Two things with retinitis pigmentosa, even though RP is a group of diseases, the diagnosis per se is not very difficult because yes, the child parents would notice that a child is struggling a bit in the night, and most of them also I think come up when the child starts bumping into objects and so on. This is one of the reasons why, especially with RP, the diagnosis is not made in most patients till they're in their 20s or so, late 20s, because that's when the visual field starts getting affected. That's when the person notices that, oh, I might have a problem. So many of them get diagnosis in their 20s with RP. So when in RP, at least, when an ophthalmologist does an eye examination, the diagnosis per se is not very difficult.